Hey guys, today we're going to talk about lipedema versus lymphedema. We got many questions since our post on Tuesday about kind of lipedema and the differences between lipedema and lymphedema and how can lipedema progress into lymphedema. So I thought we'll kind of go live and answer all these questions here. So let me type it here, write your questions below, and we will get started on that. So our patient had lymphedema that started previously with lipedema. So stage 1 lipedema, so as lipedema starts, you've got stage 1 and then it progresses to stage 2, then stage 3 and then stage 4. So stage 4 lipedema is basically stage 3 lipedema that advances to stage 4, which becomes lymphedema. So this is a very important concept. That's why we treat lipedema earlier on, so that it doesn't progress from stage 1, stage 2, stage 3, and then ultimately stage 4, which is lymphedema. And the way you can tell at home is basically if the lipedema is in the legs, kind of like the thighs, the knees, the calves, ankles, and down to the ankle area, that's lipedema. If the swelling goes into the foot and the toes, then it becomes lymphedema. So some people start with lymphedema alone, some people start with lipedema. Untreated lipedema can result to lymphedema. But lymphedema per se, if it's involving just one leg, only one side of the area, then it's usually lymphedema, especially if you've got swelling on the top, on the dorsum of the foot, or swelling on the toes themselves. And that's how you know. If you've got swelling on the toes and swelling the dorsum on the foot, you're probably into a lymphedema stage. Now, if it's one leg, then it's lymphedema. Etiology lymphedema without being lipedema. Lipedema is usually involving both legs and kind of goes usually around the thighs, 360 degree, knees 360 degrees, down all the way down to the ankle, and it involves that as 360 degrees. So these kind of like the basic concepts between lipedema and lymphedema. I had a patient asking me kind of like, she has the swelling and that just on one side. And I'm like, we've done hundreds of cases, we've rarely seen lipedema involving just one side. Most of the time it's on both sides and it's 360 degrees. It can be different types. It can be just around the stomach area, kind of that upper buttock or the buttock shelf, or it can be type 2, kind of goes all the way down to the knee, 360 degree kind of from the buttock shelf all the way down to the knee area. That's type 2 lipedema. Or it can be type 3, where it's going all the way down to the ankle, and this is the most common type. That's what we talked about tree trunk appearance, kind of going all the way down to the ankle, and this is basically type 3 lipedema, and this is the most common type. And when people talk about lipedema, they're talking about this type, but there's other types. Sometimes the arms are involved, legs kind of comes to the elbow and then goes all the way down to the with arms as well, you would have 360 degree lipedema deposition, especially you see it kind of on that kind of along that pinky finger. You would see the kind of like you would pinch and you'll get that cellulite appearance, the pebbling appearance of lipedema, and you know it's coming down to that area. So that's kind of how you know that you are type 4, because now it's also involving the arms. And then you've got type 5, which is basically from the knees down. We rarely see that. Most of the times it's the one that we see is type 3 lipedema, where it's kind of from the buttock shelf down to the knees, down to the ankle. So there you go. I just I thought it's much easier to go in here, get the live, get any of the questions you have, and I'll save it in there just for the people who are asking about lipedema and lymphedema. We do get a lot of questions on Instagram, and what I'm trying to do is kind of try to go live as much as possible, answer the most common questions we get asked. This way I can add as much value as possible. Gotta go do our patient today. We did her case on Tuesday. We did LippyLipo, and today is her second session. So from that standpoint, who is candidate for 2 sessions are people who have a blood count kind of 13 to 14 and above. We're able to do them in 2 sessions within the same week. So they fly here. We do one session on Tuesday, and then we do the other session on Thursday, and then they fly back usually around Saturday. So these are the people who kind of were able to do them. However, if somebody is starting with a blood count of like 10, 11, it's too low. those patients, we are staging them for about 8 weeks in between, so that we get their body to replenish any blood loss that they get from the lipedema, so that we're able to do them. But if the blood count is 13, 14 and higher, you'll be able to do it in exactly the same week, which is really awesome, because most of our patients, they fly here. So if we can do their 2 sessions in just the same week, it would be ideal. But if their body, if they don't have much reserve, or if they're older, or they have other medical problems, then from a safety standpoint, we do it once a week. Another common questions we got asked, and I'm trying to go over all these questions on Insta, is BMI. What's the BMI requirement? You know, kind of like truly, because LippyLipo is awake. There's no sedation, no IV sedation, no PO sedation. So most patients, there's really no BMI requirement in a way, unless the key is to be healthy, to be able to tolerate the fluid infiltration and the liposuction part of LippyLipo. That's about it. Because most patients with lipedema, they have a falsely elevated BMI because of the heaviness of the lipedema fats, kind of make it look that BMI is higher. But in fact, if you take those lipedema fat cells out, the BMIs are going to be actually lower. So it's not there's no contraindication. Now, for people who go under general anesthesia, then yes, because of the general anesthesia effect, especially on the vent, all that stuff. So you got to be careful with BMI, not with LippyLipo. Anyhow, that's about it for today. If you guys have any questions, please let me know.